Hi everyone, thanks for joining us. I'm Doug and this is Emotional Attachment Behavioral Therapy. In today's video, we're going to be talking about the roots of attachment theory and some of the relevant research out there around attachment theory. But let's start with the history of attachment theory. Attachment theory is focused on the relationships and bonds between people, particularly long-term relationships, including those between a parent and a child, and between romantic partners. British psychologist John Bowlby was the first attachment theorist, describing attachment as a lasting psychological connectedness between human beings. Attachment is an emotional bond with another person. Bowlby believed that the earliest bonds formed by children with their caregivers have a tremendous impact that continues throughout life. The central theme of attachment theory is that primary caregivers who are available and responsive to an infant's needs allow the child to develop a sense of security. The infant knows that the caregiver is dependable, which creates a secure base for the child to then explore the world. Although Bowlby was primarily focused on understanding the nature of the infant-caregiver relationship, he believed that attachment characterized human experience from the cradle to the grave. It was not until the mid-1980s, however, that researchers began to take seriously the possibility that attachment processes may play out in adulthood. In the 1970s, Mary Ainsworth's groundbreaking strange situation study revealed the profound effects of attachment on behavior. In the study, researchers observed children between the ages of 12 and 18 months as they responded to a situation in which they were briefly left alone and then reunited with their mothers. Based on the responses the researchers observed, Ainsworth described three major styles of attachment: secure attachment, ambivalent insecure attachment, and avoidant insecure attachment. Later, researchers Main and Solomon in 1986 added a fourth attachment style called disorganized insecure attachment based on their own research. A number of studies since that time have supported Ainsworth's attachment styles and have indicated that attachment styles also have an impact on behaviors later in life. These are the same four attachment styles that we use in emotional attachment behavioral therapy. We have adjusted the names to simplify the material for our clients, but the descriptions are identical to what they were before. The last decades have seen a substantial growth in research studies on attachment and substance use disorders. The general link between insecure attachment and substance use disorders today is well established, and there is moderate to strong evidence for the assumption of insecure attachment styles being a high risk factor for substance use disorder. So how does that happen? When parents or other caretakers are responsive, children receive the foundation of personal security to learn emotional self-regulation. Babies that do not receive predictable and appropriate attention from caregivers are unable to form secure attachments and thus resort to seeking alternative ways to calm their distress. For children with insecure attachments, the search for external forms of emotional support and regulation continues into their teenage years, when many people encounter drugs and alcohol for the first time. Drugs and alcohol become reliable, easy, and powerfully effective forms of self-soothing. Based on attachment theory, substance abuse can be understood as self-medication, as an attempt to compensate for lacking attachment strategies. Addictive behaviors are driven by the addict's inability to draw prolonged satisfaction from interpersonal relationships. As a result, they seek gratification outside the realm of interpersonal relationships. In a study by Zai in 2014, insecure attachment styles in 12-year-olds led to difficulty with regulating emotions at the age of 16 years and substance abuse by age 22. Jordan and Sack in 2009 calculated that secure attachment decreases the risk for substance abuse by odds ratios ranging from 0.60 to 0.70. Thus, the risk for substance abuse is about 1/3 lower for securely attached adolescents. In regards to implications for treatment, research has shown that treatment approaches should consider insecure attachment in substance use disorder patients. Since there are different styles of insecure attachment, these should be assessed and become part of individual treatment planning in the same way as information about the amount of substances consumed, family history, and co-occurring disorders. This is exactly what emotional attachment behavioral therapy aims to do. Even though there are 4 attachment styles described, attachment styles are broadly categorized as being either secure or insecure. If your needs as a child were usually met right away by your caregiver, you probably developed a secure attachment style. As an adult, you most likely feel secure in your close relationships and trust that the other person will be there when you need them. If your caregiver failed to meet your needs as a child or was slow to do so, you may have an insecure attachment style. As an adult, you might find it hard to form intimate bonds with others. You may also have a hard time trusting those close to you. We will go into more detail about each attachment style in upcoming videos, beginning with secure attachment style next. Thank you so much for joining us today. In the next video, we're going to focus on the secure attachment style and all the characteristics of the secure attachment style. I'm going to put the link for our website up above here. Feel free to check it out, and you can also take our attachment style quiz on the website. If you enjoyed the video, please give it a thumbs up, and if you want to show us your support, please subscribe to our channel and ring that notification bell so you can be notified of all the latest videos that we have coming out. Thanks again for joining us today. Take care.